Thanks for joining us, everyone, for this edition of the Creative Convo series. And this one is Navigating Health Insurance and Medicaid Benefits. And just as a little bit of background on this, so a couple of years ago, we commissioned a study from UNC Charlotte's Urban Institute. The name of that study, which is on our website, and you can read the whole thing. It's chock full of amazing insights. And it's called The Business Realities of the Charlotte Mecklenburg Creative Community. And of the many, many things that we were asking the Charlotte Mecklenburg creative community, we wanted to learn about the realities of their health insurance, right? And some of the revelations were quite eye-opening. That we saw that most respondents do have health insurance. 85% of the nearly 600 creatives that took this survey indicated they have health insurance. But a majority of those people receive their coverage through a non-creative day job. And 72% of that group stated that their employer's insurance benefit is actually an important factor, or perhaps even the main reason why they stay at that job. Only 7% of them indicated that the health insurance benefits were not keeping them at the day job. And so to us, this sort of points to a massive amount of pent-up creative energy in our community, where sort of employer-sponsored health insurance actually sort of keeps people from diving into a full-time creative career, launching their creative business, what have you, full-time. And so that's where we really wanted to pull in experts from the community to sort of shed some light on some of the solutions and other options that are out there that we may not have a full awareness of or understanding of. And so that's what we're going to be diving into between now and 7 o'clock here, is sort of demystifying and even destigmatizing, health insurance, especially the Medicaid expansion in North Carolina. That's going to be a focus of what we're going to dive into. And so to take us on this journey here, we have Natalie Marles, who is the Health Insurance Navigator Unit Manager in the Family Support and Healthcare Program at the Charlotte Center for Legal Advocacy, and Cassidy Estes-Rogers, who is the Program Director in Family Support and Healthcare at the Charlotte Center for Legal Advocacy. And under this Navigator program there, Natalie and her team, they advise clients who need assistance on understanding all the different sort of healthcare options and healthcare access and the public benefits that are here in our state of North Carolina. And just as a little sort of a side note, Cassidy was me and my wife's Obamacare navigator years ago when we relocated back to Charlotte. And so it's cool to sort of reconnect with you in this capacity, Cassidy. So it's great. It's great to see you again. Okay, so with that, I guess I think we're going to start with Natalie, right? We're going to toss it off to Natalie first. So the Zoom mic is yours.
So hi, everyone. So I'm just so thankful that said to reach out to us to do this presentation. This is kind of like what we do day to day. So I know that sometimes it's a little tricky and boring topic, but much necessary, especially right now that we are almost close to the deadline to file our taxes and to reconcile all those APTCs that you are receiving, if you are receiving some, but also to kind of like navigate the healthcare access in North Carolina, which has so many changes recently. So we are going through that. Oh, hold on. Yeah, I think everyone can see my screen.
Yes, okay. Perfect.
So, so as Matt mentioned it, so as a health insurance navigator, we help consumers to understand the healthcare access options in the state. And those options are through the federal government, which is the Marketplace or Obamacare, as many people know them. But also we help them with the state program, which is Medicaid. And Medicaid has been having a lot of changes recently. So we are going to discuss all those topics through this presentation, but also like what is the Marketplace, what is Medicaid, and all the requirements. And most important, like the income requirements and income information that you may need to get access to either of those programs. So that is So we are going to talk and focus our conversation on the marketplace or Obamacare, the Medicaid overview, and finally, after 10 years in the making, the Medicaid expansion in North Carolina. So the health insurance marketplace it was a law. It came up after President Obama signed a law back in 2013, where kind of like gives some provisions to clients to get access to affordable health insurance in the United States. This law mentioned that a company or insurance company can only use 3 criteria to make you eligible or not eligible to get affordable insurance in the States. These 3 categories are age, geographic, so your state or your zip code, and also if you are a smoker or not a smoker. Right now with the ACA provisions, none of the insurance company can ask you any questions related to health status or health diseases or anything like that. It only is based on these 3 categories. There are like financial assistance for getting health insurance coverage through the marketplace, and I'm going to explain those categories and those financial assistance eligibility rules later on this presentation. And also there are like different plans and different categories for those plans. So the premium tax credit, or APTCs or PTCs, as some people refer, is actually a tax credit, as their name stated. So it's some money that, depending on your household size and your household income, you will be entitled to get that money to pay your health insurance coverage. That doesn't mean that you will get actually some cash or some deposit on your bank account. It means that the government will pay directly the company that you select or the plan that you select with the company to get health insurance access. So that amount, it varies depending of, again, the income and the family size. There's also like a cost sharing reductions. And the cost sharing reduction is if you are below 150% of the FPL, 250% of the FPL, which is the federal poverty line, you will get extra savings. So what that means is that you are actually lower your copays, lower your deductibles, and lower the percentage of coinsurance and maximum out-of-pocket. This is only for people or for families that will below their income is below 250%. And I have a table on a slide that it will show what that income is. As I explained before, marketplace is divided in categories, so we call it the metallic categories. And these are 3 categories: that is bronze, which covers 60% of the coinsurance, silver, that is 70%, and gold, 80%. Remember that I mentioned the extra savings and the cost sharing reductions? So those savings are only eligible for people that are selecting a silver plan. And again, that their income falls below 250% of the FPL. So those extra savings are only for silver plans under the marketplace. Right now in Mecklenburg, Union County and Cavaros County, which is Charlotte Center for Legal Advocacy area, cover area, we have different companies that are serving our community, and those are Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, Ambetter, and AmeriHealth Caritas. Those are the companies that are covering insurance on those 3 counties, but they are also covering more counties. But CCLA only covered those 3 counties, so that's why we are focused only on the 3 counties. They offer different plans. There are more than 70 plans in the marketplace eligible for people to select from. As a navigators, we cannot tell any consumer which plan to select, but we can advise based on their zip codes, on their preference of network, which plans will work better for them. And also we can help determine if they are on their prescription medicine, which one will cover that prescription medicine for them. However, I always be very upfront with our consumers that we cannot tell them which plans to select. We are here to educate and to explain how the healthcare system works in North Carolina, but we cannot make any recommendations or select any plan for them. There is also, apart from those three categories that I just mentioned, there is also something that is called catastrophic plans. And those are for young adults that are under 30 years of age. And that they may have different income brackets. And those plans usually are with a high deductible, but a lower premium. All the plans on Marketplace includes every preventive service. So includes an annual checkup, all the labs that are go with the annual checkups. But these specific plans will not be eligible to get co-sharing protections or extra savings. And that's why we mention it, because some people cannot afford or are not eligible to get on the other three plans. And this at least will be an option for them to get health insurance coverage. There is also an employer-sponsored coverage. So that means that if you are an employee of a company and that company offer you insurance through your job, we have some that like there are some people that will be entitled to get on Marketplace if that plans through their company shows up that is not affordable. And what not affordable means, that is more than 9.61% of their annual income. Or that their plan, the plan that is offering through your job, will not meet all the criteria for the minimum value standard. What that means is, like, remember that I just mentioned that all plans on Marketplace have like prevention care included, and it has emergency room coverage, and has like more than 10 provisions. So if those minimum value standards are not met, that person can go on Marketplace and select a plan without any penalty or without any tax issues. Most employer benefits package will tell you what are included and what is covered through their sponsored coverage, employer coverage insurance. So you just have to review, and we are more than happy to help you understand what that means and how can you can check if you are eligible to get on Marketplace or not. So who is eligible for financial assistance? So anyone in the United States with legally present in the United States are eligible to get Marketplace if their income falls below between 100% and 400% of the poverty level. Also, any U.S. citizens or legal present immigrants. And very important, if you are not offered a health insurance that is affordable. That means if you are eligible to get employer-sponsored coverage, you are not eligible to get financial assistance through the Marketplace. And also, people that are eligible to get Medicaid or Medicare. So those are the categories for to get financial assistance, and those are the requirements. I mentioned it before that we have a table with the income information. So this is based on household size, and it kind of like goes between 100% of the FPL and 400% of the FPL. And also shows like the 250. So if you are fall below that, you know that you are going to be eligible for extra savings and extra assistance, for financial assistance to get health insurance through the marketplace. But Cassidy is the numbers lady. So she's going to explain to you like what income you should count, like what type of income do you need to count for marketplace, what type of income do you need to count for Medicaid, and all that. So I will leave you with Cassidy to explain that.
Thanks, Natalie. Most people would not describe me as a numbers lady, but sure. But for the purpose of health insurance and public benefits, I am the numbers lady. So through the marketplace and the income we talk about here and the way it's counted actually is also relevant to the way our state determines eligibility for Medicaid too. So we won't repeat this, but I want to make sure everyone understands when we talked about this very exciting thing called MAGI, or modified adjustable gross income, that's going to be relevant for both Medicaid eligibility and marketplace eligibility. And so what is MAGI? MAGI is a combination of your adjustable gross income, which many people know is sort of this number that comes out. How it comes out, we don't know, but on our 1040 on the front page. And that's the typical countable income for these programs. But there are a few additional items that can be counted for purposes of the marketplace and Medicaid that aren't traditionally taxed in the same and in the adjustable gross income. And so the non-taxable Social Security benefits are one of those. So if you're receiving Social Security, retirement, disability, survivor's insurance, those are typically not taxed, but they can be counted for purposes of income eligibility for both the marketplace and Medicaid. Another area that may not be taxed but would be counted is tax-exempt interest, and also excluded foreign income. So certain foreign income isn't taxed in the United States, but it would still be counted as part of your income eligibility determination. Slide. So this is an overwhelming slide, I know, but we just have it here as a reference as well. I'm not going to read through it, but this lists generally the types of taxable income that go into that bigger bucket of adjusted gross income. And that is where you can sort of refer to those. There's a lot of things, I'm sure that, you know, Matt highlighted that wages and employer-sponsored coverage is a big draw for many of you, but those wages are obviously like your standard taxable income. But, you know, there are a lot of different types of taxable income. Tips can be taxable. Self-employment income has its own way of being taxed. Unemployment compensation is taxed. Social Security can be taxed after a certain amount, but that non-taxable portion also counts for this, as I mentioned before. And some retirement, a lot of retirement actually can be taxed. So this is just a reference guide to say what is taxable and what is not. But those are going to be sort of the ones that we see the most often. Next slide. These are some of the most common non-taxable income that will not be counted. So we get a lot of questions about this, like, does this count? Does that count? And one of the big changes that happened was alimony. So when the Affordable Care Act was implemented and we started being able to go into the marketplace and offer financial assistance, that we did count alimony. But in 2019, the tax rules changed about alimony, and that is no longer taxable income that will count towards eligibility for the marketplace or Medicaid. Another thing that I like to highlight is that pre-tax deductions don't count. So typically when we look at our, this all gets taken out ahead of time. So for purposes of our taxes, it's something we don't really see, right? It's gone before, it's taken out before taxes are withheld, and it's not even counted, so they don't withhold that. But it can be really important for some marketplace, but more often Medicaid. When you're applying for Medicaid, a lot of people tend to put, they ask you for your gross income, and so you have to put what it was before taxes. But a lot of people leave out the pre-tax deductions, especially when applying for Medicaid. So it's just a important thing to keep in mind. And what I mean by those pre-tax deductions are 401k contributions. If you have a cost for a health insurance plan or something like that, other, some savings accounts that you can do. Also, one that is what we call an above the line deduction is student loan interest. Now, that's not going to come out on your pay stub, but that comes out on your 1040 above the line. And that term actually was coined before tax reform. So the line doesn't exist anymore. So it's a little confusing, but it comes out before your adjusted gross income total. So that is one of the things that you'll see on your 1040, but should be taken into account when you're thinking about your income eligibility for the marketplace or Medicaid. Next slide. I'm getting very deep in the tax stuff now, especially for creatives, and especially if you want to free yourself from the job that you keep for health insurance. Self-employment is one of those things that is not just tricky for your taxes, but for estimating your income when you go into the marketplace, and even for Medicaid. And there's just a few things I want to highlight, especially for this group, is that anytime you're thinking about income eligibility for the marketplace, you're forecasting for the year in the future. And that can be really difficult with self-employment, even more so than someone who has sort of a standard wage that they can pretty much predict. I mean, no one never knows what will happen, but you have an idea of what your income will be, and self-employment can be a little more variable. So that's the first thing. The variable income can be a little bit more difficult to anticipate and to estimate. But using your previous year's tax return is always a great strategy to make sure you're at least trying to think about all the buckets that might apply. Business expenses and the self-employment tax deduction are also very important. A lot of times, someone comes to a navigator and say, okay, well, this is what I plan to bring in through these 1099s and this gig and this, but they aren't really sure what their business expenses will be. And that's what you have to kind of figure out on your Schedule C. Navigators are not tax preparers, nor am I. So we always have to remind people that you're going to want to get tax advice when it comes to estimating this income, especially when you're working with self-employment. If you have any questions about the expenses, and expenses are defined by the IRS, business expenses, and you should always consult your tax preparer on it. But I've worked with a lot of creatives doing health insurance work, and there are a lot of unique deductions that are eligible. Musicians have depreciation of their instruments and things like that. So you definitely want to take those into account when you're estimating your income. And this is all what's kind of done on that Schedule C. The other consideration here is the self-employment tax deduction, which is done on the Schedule SE. And that's one of those above the line deductions for the line that doesn't exist anymore. But there's a whole way to figure that out. And that comes from your Schedule C. But when you're meeting with a navigator and thinking about the future, you kind of have to anticipate that Schedule SE deduction as well, because it changes your adjusted gross income. And so similarly, and even more complex, is the self-employment health insurance deduction. And the way that works with APTCs, those are the premium tax credits that you get. That's the financial assistance. And you get those, the A is advanced, by the way, because you get them for the future, right? estimating the future. So you're getting the tax credits before you've actually really earned them. And you have to estimate that based on that financial assistance is based on your estimated income. But that whatever premiums aren't covered by APTCs can be used as a deduction. So this is a very complex thing to explain, but essentially, if you have a $200 premium and $150 is covered by an APTC, you're still paying $50. That $50 can be used as what we call an above the line deduction. Well, that reduces your adjusted gross income. But wait, your adjusted gross income is what figured out the amount of your APTC. So a lot of times the interplay between these two things has to really be thought out. And quite honestly, with a lot of people who were self-employed that I worked with, this was what we called like the cushion. We didn't estimate it in income. And they just knew that hopefully if their income went a little higher, this would be a cushion for them, or if their income was lower, that they just get a bigger refund. But it is one of those things that you need to be aware of, especially when you're self-employed, because those two things they can work against each other and with each other at the same time. So those are just things I wanted to highlight for self-employment, but generally, you're counting all that income and just making sure that you're taking into account those the income that should not count, the pre-tax deductions, to figure out whether you're eligible. Next slide. So that brings us to Medicaid in North Carolina and the big change that we've had in our state. And I'll get us started, and then I'm going to pass numbers back to Natalie. So Medicaid historically in North Carolina was limited to very specific categories. And those were before Medicaid expansion, which started on December 1st of last year, were mostly children. Children we have always had pretty extensive coverage under Medicaid for, and that goes up to 19. And then there's another group that can qualify even up to 21. Pregnant women, we also have very generous Medicaid coverage and income eligibility rules for pregnant and postpartum women. Caretakers of children under 18 is a category that has to be very low income. People who are blind or disabled can qualify if they're under 100% of the income level. Same for people 65 and older. And then there are some other specialty groups like foster children can receive Medicaid up to the age of 26 and things of that nature. But the big change here was, what about people who are just living with low incomes, who aren't a caretaker of a child, who aren't blind or disabled, but are really struggling to be able to afford, employer coverage or private coverage in the marketplace? And the marketplace, a lot of people were in what we call the Medicaid gap because the marketplace does not cover anyone under 100%. So you were literally, your income was too low to get any help. And that was a result of North Carolina not expanding Medicaid at the initiation of the Affordable Care Act. But now so excited about that because so many people are now eligible to receive Medicaid. Next slide. So the law was enacted on March 27th, 2023. And while it seemed very excruciating slow to us in the health policy space and navigators, it was actually pretty fast of an implementation period. And it went live on December 1st. So now thousands of people, it was estimated nearly around 600,000 people gained eligibility to Medicaid with this change. Next slide. And specifically, this group is North Carolina residents between the age of 19 and 64 with countable household income under 138% of the federal poverty line. That's a very specific number and it changes each year. It's set by the government. So We don't put those numbers on here because they change every year, and it's something that a navigator can always help you figure out the limits for. You no longer have to fall into some specific category. There's also no asset test for this population. A lot of the age, blind, and disabled groups have to show that they have assets that are very low, under $2,000 for countable assets. And this particular coverage isn't designed to sort of penalize you for having any resources. It's meant as a safety net if your income is below a certain level. So they don't even look at assets. Unfortunately, it didn't expand any of our citizenship rules or alien rules. So basically, the way our Medicaid program works is for most programs, you'll have to be a U.S. citizen or qualified immigrant. Natalie will get into some of the details and caveats to that a little bit later on. But there have been no change to eligibility rules for children or for those aged 65 or older or those receiving Medicare. They will still need to fall under their categories and meet the income rules for those categories. Next slide. So state residency is one of the main requirements. You may have to provide proof of that. You must be a U.S. citizen. You must be in certain groups, and you must meet the income limits. And as I said before, the resource limits but those only apply to the aged, blind, and disabled populations. Next slide. I'm going to pass it over to Natalie and let her explain the differences between the income for Medicaid and Marketplace here.
Yeah, I have lost my button for the camera and for the mic. So unlike the Marketplace, Medicaid income eligibility is based on a monthly instead of like your annual expectations. So when you meet with a navigator, the navigator will ask you for like some certain information to see which program are you eligible for. And one of those questions is income. Some people, their income varies because like teachers, and I always give the example of a teacher, is because the teacher has like some months that it will not have any income, but still their annual income will be counted for Marketplace. For Medicaid is a little bit different because we only count 30 to 60 days prior to the application date. And that's because Medicaid is on a monthly base income eligibility instead of an annual income eligibility. Also, the income is calculated by looking at the base period. So that is the income of the month. And that's what I say is always like between 30 and 60 days because it's always depending on the day that you are applying during the month. And that income change. So there are some exemptions. So if you have lost your job in the last 30 days, so that will also count and it will be an exemption for your income. We also have something in Medicaid that is retroactive. So they will see if we are asking for retroactive coverage, that means that we can ask for up to 3 months before the application date to get you covered. We are going to have to calculate those incomes as well. So I'm not going to go into deep with this because Cassidy already mentioned the general income eligibility, and it's basically the same thing for Medicaid. So I just mentioned that we have some certain difference percentage depending on the Medicaid category that you are eligible for. So again, you don't have to memorize this. That's why the navigators are always available to help you understand like what type of income do you have and also in which bracket do you fall under the FPL, so we can make sure that you are applying to the correct program under Medicaid. This is just a chart, kind of like a educational part to see if you are a pregnant woman or children, or what will be your income bracket, and also if you are children under 18, if you are children or a young adult between the age of 19 and 20, if you are a parent, if you are an adult, and also if you are age blind or disabled. Cassidy and I mentioned it during our presentation, like the qualified immigrant and lawfully present immigrant a lot. For Medicaid, you have to be a qualified immigrant in order to qualify for Medicaid plans. And then for Marketplace, you have to be lawfully present immigrant in the United States. What is the difference? So the difference basically the type of status that you have in the United States. So for qualified immigrants, that's your legal permanent residents, your refugees, your asylees. And I will say that asylees, especially asylees right now, because we have a boom of newcomers recently in the Charlotte area, I would say that asylees, they need to have their asylum process approved in order to be a qualified immigrant. Also, persons with a granted withholding of deportation and renewal approval notice, Cuban and Haitian entrants, victim of trafficking, battered spouse and children under VAWA. And there are other categories. So again, you don't have to memorize everything. You don't have to memorize every single immigration status that is available. That's why navigators can help you understand that. There are some other exemptions that we can also talk about it into more deep when we meet with a consumer. Then for Marketplace, you have to be a lawfully present in the United States. And that means that you have any type of visa. So that includes U visas, T visas, V visas, TPS, special immigrant juvenile status visas. Unfortunately, the only category that will not make you eligible either for Medicaid or Marketplace is DACA. And that's something that we are been advocating for a while. The same thing that we did for Medicaid expansion in North Carolina, we've been doing it for DACA recipients, because it's not fair for them to have other to not have access to healthcare, basically, because if they are DACA recipients, they are not eligible either for Medicaid or for Marketplace, unfortunately. They only are eligible to get low-cost clinics or free clinics, assistance, and the emergency room. And as you know, that is very expensive. So we also have a lot of benefits that immigrants can qualify for, and this is kind of like the list. We have Medicaid, Marketplace, also something that is for food stamps. So that's a food and nutrition services that some qualified immigrants will qualify for that. Medicare, Social Security benefits, workforce or cash assistance, and then the summer food assistance, which is for undocumented children that can receive that. For lawfully present rules, there are a lot of restrictions regarding public benefits. You have Medicaid, but only is for pregnant women or children under 19. The ACA, every status, as I mentioned it, except DACA. Food stamps, if you are lawfully present, unfortunately, you are not eligible to get food stamps. And Medicare is only if you have worked in the United States for more than 10 years or accumulated 40 credits of work. And the same thing with Social Security benefits. This is our contact information. I also wanted to mention something that we've been seeing a lot, and I don't know if anyone in your community have been suffer of this. So lately in the past 2 years after COVID, there is a boom of broker and agents insurance fraud cases. That means that people are not aware that some of these broker or insurance brokers or agents are being signing people without their consent. And now that they are filing their taxes, some of these cases are coming to light because they will have restrictions to file their taxes because according with the IRS, they will own money or they were not eligible to get those credits and they were getting credits. So we are also helping with those. So if you know someone that were signed for marketplace without their consent, or was didn't have any immigration status that make them qualify for marketplace and were signed under the presumptions that is a free health insurance in the United States because you just cross the border or because you just enter the country, send it our way. We are more than happy to help those clients. We are also working on different advocacy groups to kind of like prevent those frauds and scams. But we've seen a lot of people right now getting affected by this. So we are trying to spread the word and try to make awareness of this situation so people are very aware and also will not give personal information to anyone that receives a call. Marketplace will never call you to kind of like promote marketplace insurance. They will only call you if you escalate a case or if you have filed a complaint with the marketplace. But they will never call you. The same thing that IRS will never call you. They will send you a letter. Is the same thing with marketplace. They will send you like some advertisement. They will send you like some promotional material, but they will never call you to sign you up for health insurance. So just be aware of that situation. And right now we are open for questions.
Great. So any questions at all? You could either drop them in the chat or just, we have a small enough group this morning that you could just take yourself off mute and ask your question as well. Okay, so here's some questions here from Julia. Very new to the Medicaid world. Finally got the courage to quit my job last year to pursue my passion for cooking and food content creation full time. Last January 18th, applied for Medicaid. Kept checking my application status and it always showed pending. Finally, just this week, it showed approved. Does that mean I officially have Medicaid? What are the next steps once my insurance affordability is approved? I have not received any card or letter in the mail so far, so I currently don't know which coverage I have, or if any. So if you want to, either one of you can kind of field those couple of questions there.
Can we ask a follow-up question, Julia?
Yeah.
How did you apply? Did you apply through the state portal called ePass, or did you apply through the marketplace?
And Julia, you're welcome to come off mute and answer any of these questions directly if you feel comfortable.
Hi.
Hey.
I applied through ePass.
Okay. So that's good news, I guess.
Okay.
I'll let Natalie kind of speak to ePass. She's the ePass expert, but generally that does make sense. And she's dropped a really important tool here that I'll let her explain as well. But what I want to just kind of cover really quickly is that Medicaid is what is managed by managed care plans. So a couple of years ago, we had a big transformation in the way Medicaid services were delivered. We went from what we call in the world fee for service to managed care. So my really layperson way of explaining that is that insurance companies are managing Medicaid right now. So you basically you will get auto assigned to one of those plans. You have 90 days to change the plan that you are interested in, and Natalie dropped that a link there that can serve for multiple reasons. But we also have a team that we work with legal aid and PISCA Legal Services called the North Carolina Medicaid Ombudsman, who is here to help you if you encounter any issues with your plan, or if you have questions that the plan can't answer or the enrollment broker isn't answering for you. The North Carolina Medicaid Ombudsman needs to be your is who you need to call. We are we are separate from our organization, but the good news is all of the Medicaid experts in our legal departments built the Medicaid Ombudsman program and have the support when needed, and you can get like direct referrals from that program. So I want to say that about just managed care generally, and I'm going to let Natalie kind of tell you about the process for EPAS.
So the good news is that on your EPAS, it shows that it's approved. So the next steps, you are supposed to get a letter, and that letter is gonna give you like your certification dates. I just want to make sure that you save that certification date as a reminder in your calendar, because you need to recertify every year, and it's usually 30 days before the due date. So let's say that your recertification, so you mentioned that you apply in January, so your Medicaid should start on January 1st. So if that day is different, just call me, because then we will help you fight for your rights, because they are supposed to take to start on the first day of the month that you apply, not on the day that you receive the notice. So that's one thing. The second is, as Cassidy mentioned it, Medicaid is now managed by different programs. So if you select a specific provider during your EPAS application, you are supposed to be enrolled with them. However, we have seen a lot of cases that changed during the application process. So you have 90 days to change that plan if you don't like it, or if you know that your primary care physicians do not accept that type of insurance. So I put on the chat a very good tool. They actually have a live chat during work hours between 7 a.m. and 5 p.m. So you are more than welcome to go tomorrow, chat with them. They will tell you when is your certification date, but also it will tell you which plan are you enrolled right now. And if you want to change it, you are more than welcome to change it within those 90 days. Then you have to select a primary care physician. So just make sure that if you have a primary care physician right now that you like, ask them which plan of Medicaid. I don't trust 100% of the enrollment broker to tell you if that PC, like if your doctor is covered by that company or not. I will always ask my clients to double check with their doctor's office, just to make sure that you don't have any surprises, because right now, as Cassidy mentioned, Medicaid is managed by these companies, and you will have charges as an out-of-network if that doctor's office is not receiving that specific plan that you are enrolled. And in that, also in that page, you can find like the difference between plans and between providers and what incentives do you have. Every plan have different incentive. So I will highly recommend you to go and check that website. And also Cassidy dropped the Medicaid Ombudsman website as well. Your Medicaid Ombudsman, just keep it in hand, because if you have any issues later on with your Medicaid, if they are denied any type of services, your Medicaid Ombudsman will fight for those rights. So just keep those two links in your bookmarks, or in a safe place that you can get access to it.
Great. Hopefully that answers your question. Any follow-ups there, Julia?
Yeah, I just want to say thank you so much for answering, and Yeah, no, that's it. I just wanted to know if I should expect something in the mail and all that. So yeah, thank you.
Yeah, you should receive like an email. I'm sorry, an email, no, a letter from the Department of Social Services. If you live in Mecklenburg County, that comes from Mecklenburg County DSS, where it says like you are being approved, your dates, and the type of Medicaid that you're being approved for. Um, I assume that it will be under the expansion, but I don't want to make any assumptions, and you are more than welcome to give us a call if you have any follow-up. And then you also will receive a welcoming package from the company that they enroll you, or if you change that company, you will need to wait for that welcoming package as well.
Okay, I understand.
Cool. Okay, great. Thank you. Any other questions before we wrap up this evening's session? Any questions at all?
Yeah, I had one.
Yeah, go ahead, Troy.
So it's about the Medicaid income eligibility. So you said that it's the eligibility is based on monthly instead of annual earnings. So I'm not sure I fully understand how this works with that in the base period calculation. But in general, I guess my question is, for creative careers, for freelancing, your income can vary widely month to month. And so I'm trying to understand how that impacts the income eligibility if you might have a large income one month and then none the next month. What happens to your Medicaid eligibility at that point?
Yeah, it's a tricky thing. And there's special rules for variable income, and there are certain situations where Medicaid program can average that out over time. But generally, it's supposed to benefit you, not hurt you, if that makes sense. But there are also reporting obligations though that you have too. So, if you have I don't know, a $10,000 month, you need to report that, but it should be averaged out if that's the better way for you. There's also what we call a gap filling rule. If your annual income would make you eligible, but not your monthly, they should use that rule. But generally speaking, it's just sort of the traditional way that Medicaid has operated to verify income. They only really have the capacity to look at the month before, right? So they're going to ask you to turn in those pay stubs, to turn in those documents. When you're self-employed, what a lot of our consumers or clients that we work with, if you aren't keeping books, they have sort of a self-employment ledger that you can fill out to sort of help you report some of those business expenses and deductions. If you keep, if you're working with an accountant or something like that, they can usually print those off for you. But if you're more so waiting to do that all at the end of tax year, then you're to do that monthly income, you're going to want to pull just together a little bit of a ledger of what those business expenses are and what income you brought in through 1099s. And they actually have a document that they'll give you to do that you can pull offline as well. Natalie, do you have that you could drop in the chat, maybe the self-employment ledger? You can pull them off of Google too, like, just any self-employment ledger. All they need is something to really verify what's coming in versus, what's going out as far as expenses. That's how they deal with self-employment. They also usually ask for self-employment for your 1040 just to verify. Well, actually, depending on what time of year it is, they can pull electronic matches from your last 1040 to just verify that if you have a self-employment ledger, that it's on track with what you've reported in the past. But as with anyone, like we've had terminated income and things of that nature, and they'll give you an opportunity to explain that if there is some type of inconsistency.
Thank
Does
you.
that help answer your question?
Yeah, it does.
Great. And we are always available. The navigators are always available to help you. And I think one of the most unique things about our program is that we have this sort of, we call it like the circle of life when it comes to like health insurance. We've got the navigators who can help you apply and do everything you need to do. If you're in Medicaid, we then have the ombudsman who can help you, work within those plans. But when it all goes wrong, we've got the lawyers over here as
Yeah.
well that can come in and say, no, this is how it's supposed to go. And all of our teams work together to report to kind of refer back and forth. So we have sort of a quite the ecosystem to try to help make sure that everything that's available to you that you're eligible for, you will get and maintain.
Yeah, I'm
I
really
just sorry.
glad you said that. Yeah, because the Charlotte Center for Legal Advocacy is just an incredible resource, an incredible organization. So I'm glad you explained that ecosystem. Who did I cut off there?
I just wanted to mention to Troy that I just dropped the link. This is what we use for when we are helping a consumer with self-employed income. Beyond the Basics, that's an amazing resource for us. So if you don't have a tool to calculate your self-employed, you are more than welcome to use that one.
Yeah. And I'm really glad, Troy, that you asked that question, because what you explained is the reality for so many creative entrepreneurs, so many artists. Our income varies wildly from month to month. And so it was a very relevant question. I'm really glad you brought it up. We're at the 7 o'clock mark. So unless there's any urgent final question, I just want to personally say to both Natalie and Cassidy, thank you so much for your time, for sharing your expertise with our community, and we have recorded this conversation, which is going to allow us to further share this information with the broader creative community here in Charlotte as well. Sethu, anything I'm leaving out or missing?
No, just another thank you to both of you. Thank you so much. We're really grateful. This is such good information and really excited to have it up on our resources page for everyone else who's going to tap in later. Thank you.
Thank you all for inviting us. We're happy to help anytime, and please, you've got our information. I'm sure we shared the call number, and we are year-round, no income limits either. I think that's another really important thing. The navigators don't have an income limitation for their services. They are available to anybody. So even if you're in that height of your career and just trying to figure it out, they can help you navigate that.
Yeah. Yeah, it's an incredible, I can't underscore it enough. I mean, the Charlotte Center for Legal Advocacy is this incredible resource that is here in our community, and they're waiting to help. So please don't hesitate to reach out to them directly and share your knowledge of this now with your colleagues, your friends, your family, so that they're aware that this resource is out there as well. So Cassidy, Natalie, thank you for joining us for this Creative Convo. And I can't wait to continue this conversation, because I know we will, as we continue to sort of educate the creative community on all the different resources and options that are out there for them.
Thank you both.
Bye, everyone.
Bye, everyone.
Thank you.